Hello and welcome to McLaren Port Huron's Today's Health. I'm your host, Barb Winters. Our program today is about drug and other substance abuse, and for this first segment we're going to be talking with the Medical Health Officer at the St. Clair County Health Department, Dr. Annette Mercatante. Dr. Mercatante, welcome back to Today's Health.
Thanks, Barb.
As a context for our discussion, can you just kind of give us a definition for drug and substance abuse?
Well, the simplest definition I've ever heard of substance abuse is when you continue to use something even though it's causing you harm or causing other people harm. Very simple. There's all kinds of gradations of that, but if you're using a substance to the point where it's causing you harm, you're not using it as it's intended in the case of prescription drugs, then we consider that abuse.
So actually, it isn't just illegal drugs that are abused.
Right. Well, we're having a tremendous problem with prescription drug abuse.
Okay.
And prescription drugs abuse, in my opinion, in many ways is what we call iatrogenic. It's caused by physicians and the healthcare provider world providing medications in good faith most of the time, and then people taking those and using them in the wrong ways. And there's lots of reasons for that, but a lot of it stemmed from our transition in the healthcare world of more aggressive treatment of chronic pain. There was information that we now know is really not very evidence-based on using opiates for chronic pain. And what we've learned, and what we are learning, unfortunately in a very sad way, is that the risk of opiate use in chronic pain far outweighs the benefit. And we have to do a better job, and we have to rethink probably a good 10 or 15 years now of how physicians have been trained to manage chronic pain. So that's one aspect. Physicians aren't responsible for drug abuse and the people's need or desire to alter their sensations with substances, but the proliferation, the sudden access to opiates has really created a unique and stunning problem in our community.
And people do all sorts of behaviors. Like you say, physicians can't manage how if I see you're in pain and I say, hey, you want one of my pain pills, is that abuse?
Yes. Okay. Technically, if you are providing a substance or a prescription that was meant for you and you're giving it to someone else, that is abuse. That is abuse of that prescription.
Okay.
It's extremely common, and I'm sure well-meaning. But what we're finding is people don't understand the dangers of these pharmacological agents. They're very potent. For instance, we know that the combination of two very common drugs, one we call sedatives or benzodiazepines, which are commonly used to calm people's nerves, your Xanax and your Valium. If you combine that with an opiate, your risk of accidental or unintentional overdoses is much, much higher. It's a very dangerous combination. Most lay people don't necessarily know that. They don't necessarily know to ask what other meds people are taking when they offer them something that, in good faith, they felt was something that was going to benefit that person.
So then this causes medical emergencies for whoever is doing this. What's the most common one?
Well, so you're talking about the most common emergency room visits. By far and away, the most exponential increase has been for prescription drugs. The most deadly prescription drug we have is opiates. Okay, so when you exceed your body's tolerance to an opiate, it suppresses our respiratory drive. It makes you stop breathing. Obviously, there's a loss of consciousness, but if you stop breathing, you can't respond, you can't help yourself. And so opiate overdoses are particularly lethal, and we're seeing an exponential increase in those in particular. Overall, there's a lot of emergency room visits just for prescription drug misuse.
So how easy is it to overdose or abuse on prescription drugs?
So let's talk about opiates again, because that is by far my biggest concern in this community. So if you had never taken an opiate before and you took a certain milligram amount, at a higher level, it would immediately make you stuporous and may have you lose consciousness and it'd be dangerous to you. If, on the other hand, you took a lower dose and you took it consistently, within a very short time your body would become what we call tolerant. Okay? Tolerance means that you can metabolize these drugs, you can tolerate that level of medication much better than you could at the beginning. And in fact, what happens is that you need more of the same medication to get the same effect. So if you're using it for pain, for instance, what you used to get away with 5 milligrams, now you need 10 or 20. And that tolerance has really no limit. You can keep going up and up and up. But unfortunately, what happens is as your tolerance comes up, that threshold of overdose stays the same.
Okay.
And you get closer and closer. And you start adding other medications to the mix that make it more lethal. If you have problems with metabolizing, say you have underlying kidney or liver issues or things that are also making it hard for you to clear that drug, just age alone makes it harder for us to clear those drugs, then over time there's this accumulation. So it's a very unpredictable thing. And some people can get away with very, very large amounts and seemingly tolerate them very well. And then other people, even small amounts, can throw them into very serious problems.
Wow, that's sobering information. We're going to take a break and come back and talk some more.
Thanks.